Elsewhere today, new guidelines out for emergency room doctors to keep everyone safe from Ebola. The guidelines come as 7,000 ER doctors meet here in Chicago. CBS News' Dorothy Tucker reports on what's changing for patients and healthcare workers.
What do you do? What do you not do?
Emergency room doctors among the first to touch sick patients in the ER. Whether any of those patients have the deadly virus Ebola is a concern.
This is a little bit more critical because even a microabrasion can cause entry of Ebola.
Everyone's very concerned about it now. You just have to follow the protocol.
Protocol to manage Ebola was the hot topic at the American College of Emergency Physicians Conference.
How do I treat my patient without exposing myself?
At the top of the list of new guidelines, all patients will be asked about their travel history.
Do you have a travel history to an endemic region? Were you in contact with someone that was symptomatic from that region?
The guidelines obviously include wearing protective gear, but also recommend limiting the number of healthcare workers who treat Ebola patients.
Maybe just one nurse and one doctor. You know, you don't have every staff member being exposed.
The recommendations were developed after reviewing Ebola cases and listening to the personal experiences of healthcare workers like the nurses interviewed last night on 60 Minutes. So now there is an increased focus on the equipment used to draw blood.
Every circuit is double checked to make sure that there are no loose connections that might allow blood to spill into the room.
The CDC also issued an update on its recommendations today. They're asking healthcare workers returning from the so-called danger zones to voluntarily stay home for 21 days and avoid mingling with large groups of people. Okay, Rob?
Okay, thanks a lot, Dorothy.